A moment that is filled with both happiness and worry for future parents.
It's like we're having a baby.
Social networks are filled with such videos. However, it's pretty hard to find stories from the other end of the spectrum, families talking about miscarriages.
But then there's a heartbeat, so it's like, but obviously you don't want...
Heather Hodnicki and her husband Joe, parents of a 1-year-old boy, recorded this video when doctors told them Heather's second pregnancy is unlikely to be viable. A hematoma formed around the fetus, and at 9 weeks, Heather had a miscarriage. Instead of closing up, she started a blog on Instagram where she shares her difficult experience.
It was a loss of a little life, and then I would relate to it as you know, it was a little soul that was with me, and that I saw a heartbeat on the monitor, and then that little soul was gone. So it talking to other women took the taboo. I mean, I know it's something that's very taboo to talk about, but in doing so, it made it easier for me to process the fact that it is a loss, and I am allowed to feel the emotions that I'm feeling.
Out of every 100 pregnancies, about 10 to 15 end in miscarriages, and a lot of women blame themselves. Doctors say a miscarriage before the end of the first trimester usually means the embryo had chromosomal abnormalities.
We've just going to present next month a study on 55,000 patients that had miscarriages, and they had genetic testing on the miscarriage. 56% of the pregnancies that were lost were genetically abnormal.
Doctors say age plays a critical role.
If a woman is in her 30s and has 1 or even 2 miscarriages, there can be a reason that is structural, in other words, like a fibroid, or can be immunological or hematological. That could be a clotting disorder or an antibody, could be an infection. So there could be something that is really treatable. If a woman's in her 40s, then recurrent miscarriages are usually due to the eggs not being healthy, because when a woman's in her 40s, almost 90% of the eggs are chromosomally abnormal.
Doctors say that most women who have experienced a miscarriage will in time give birth to healthy babies, most of them without any special treatment.
I had a patient years ago. She came in and she was in her early 30s. She'd had 27 miscarriages. And I said, first I didn't believe her. I got all her records, went through them. They all had been documented. She had had most of the tests done. And we completed the tests, and really, in her case, there were a few little things that were off, but nothing major. And after I got all her information, I said, can I ask you a question? I asked her, I said, I've been seeing patients with miscarriages for many, many years. I can't even imagine how you can think about trying to have another pregnancy after having 27 pregnancies and 27 miscarriages. And she said, Dr. Couttet, I just know that I'm going to have a baby. And I said, well, as long as you're willing to still have hope and continue trying, then I'm willing to do everything that I can to help you. And she eventually, with her next pregnancy, did have a pregnancy.
3 months ago, Heather gave birth to a healthy baby girl. Like many other women who have gone through a miscarriage experience, she calls her daughter a rainbow child. And baby Willow, unknowingly, helps her mom heal very fast.
It's always emotional thinking about that baby that we lost. The best advice that I can give to women who are going through something similar is to reach out to your friends, reach out to your family, possibly reach out to your doctors, see if they can give you any advice on who to turn to, who to talk to. Definitely, talking it out with anybody I find helps.
For Anusha Vitisyan in Washington, Anna Rice, VOA News.